Good afternoon and bonjour à toutes et à tous. Je suis seul aujourd'hui. Mon collègue Dr. New est en vacances. So today I'm going to start with, of course, some update on numbers. But, it's Labor Day coming up. So as Labor Day marks the unofficial end of summer, I'd like to talk today about some ways that we can reduce our risk of COVID-19 as we head into the fall and the holiday season. So I'll begin with the update on numbers. There have been 130,493 cases of COVID-19 in Canada, including 9,141 deaths. 88.5% of people have now recovered. Over the past week, close to 46,000 people were tested daily, with 0.9% of people testing positive. An average of 525 new cases have been reported daily during the most recent 7 days. Throughout the summer, Canadians worked together to reduce the spread of COVID-19. We wore masks, washed our hands frequently, and avoided crowded spaces. As a result, the infection rate in Canada as a whole has remained low, which has allowed many public spaces to reopen. Pour bien des gens, la fin de semaine de la fête du travail est synonyme de la fin de l'été et du début de l'automne. Nous savons tous que l'automne apporte un temps plus froid, ainsi qu'un temps où nous réunissons avec nos proches. La plupart d'entre nous ont passé le printemps dans une petite bulle de contact physiquement éloignée de beaucoup de nos amis et de notre famille. Nous l'avons fait pour aplatir la courbe et réduire notre risque de contracter et de propager la COVID-19. Je tiens à remercier les Canadiens pour leurs efforts. Je sais qu'il a été difficile d'être séparé de nos proches, car cela a certainement été le cas pour moi. Canada faces a different COVID-19 situation in September than it did in February and March. Governments, businesses, and Canadians themselves have adapted and worked to put measures into place that help keep COVID-19 in Canada on the slow burn path that we need. With fall and winter approaching, families and friends once again want to know if it's safe to gather together indoors. No individual and no family faces the same set of circumstances, and we will need to make decisions for ourselves. While we cannot eliminate all risk, and the situation may change, I want to offer some advice on how to decide if attending an event is right for you. Canadians should ask themselves some quick check questions, 2 about their risk factors, and 2 about the location of the event or activity they're thinking of attending. The first 2 questions address your own risk. First, are you at high risk of developing serious complications if you become infected? Or if you would have to self-isolate, would this seriously disrupt your upcoming plans, priorities, and responsibilities? 2, are there people at high risk of developing serious complications of COVID-19 in your household or in-person contact bubble that you could unintentionally infect? Then ask yourself 2 questions about the location of the event. 1, has the host made changes to the location to reduce the risk of spreading COVID-19, including making it easy to maintain a physical distance from others while indoors and requiring others to wear face masks? 2, are you able to adjust your plans at the event or activity, for example, by stepping away if it gets crowded, wearing a mask, and washing your hands? Finally, know there are things you can do before you go to an event or activity that can reduce your risk and the risk to your loved ones. As I've said many times, if you have any symptoms, even mild ones, stay home, stay away from others, and get tested. Keep up with effective public health practices, such as physical distancing, hand washing, and wearing masks or face coverings. And limit the number of locations and events or activities you attend in the days and weeks before a planned important activity to reduce the risk of spread during the event. This will provide layers of protection to keep you and those you care about safer. It is important to remember that just because you know the people at an event outside your household and contact bubble, it does not mean the risk is in any way reduced. Don't let your guard down. Keep following good public health practices. Donc, gardez le cap and bonne fin de semaine. Have a safe long weekend, and let's head into the fall with confidence that we'll get through this together. Thank you. Merci.
Thank you, Doctor. We will now open the floor and the telephone line to question. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking question in the room, we ask that you make your way to the freestanding mics. Today we'll start in the room. CBC?
Barry with CBC. Dr. Tam, can I ask you, you've had about 2.2 million people download the COVID Alert app. I think it's 125 people who have reported symptoms. How would you rate the uptake so far on the COVID Alert app?
So the more the better, that's all I keep saying. And so 2.2 million or so, I haven't looked at the latest figures, that's the last that I heard, in the context of Ontario, is actually not too bad. I mean, I looked at some of the other countries. I mean, even from a single country, the download hasn't been this high. But we can definitely do better. And I've been encouraging more people to download, particularly those who have phones and who perhaps in the younger age groups who frequent places where you can't account for all of the contacts is really, another way that you can help with faster notification and contact tracing. I was really happy to hear from Ottawa, for example, that the first case that's been reported after someone loaded their key after they got the positive lab test, and someone actually then got tested themselves. It was found to be positive. So that's we need to certainly hear more about that. But there is no doubt that we should do better. And I think for people who have downloaded the app, just remember if you get a lab test to actually download that key, because this Ottawa example has shown that it can work. And I certainly look forward to other jurisdictions then joining in the near future as well. And so I do think that we should give it some time and then have a look further to see how it's working and go on from there. But, Labor Day, long weekend, people going back perhaps to educational institutes, those kind of settings, you can't necessarily account for every one of your contacts, then I think it's good to download that.
Thank you, Doctor. Follow-up?
How are you measuring, I guess, the relative success of the app? Is it just the downloads, or does it go beyond that?
Well, I think that there's many ways to measure it. I think the downloads is one. And as I said, the number of people who actually key in their, special key once they get a positive test is one. Ultimately, of course, getting people who have been notified and get tested is another one. But we would have to work closely with local and provincial public health, because that kind of data is much more readily available, of course, at that level.
Thank you. Prochaine question à Radio-Canada.
Oui, bonjour, Philippe-Vincent Foisy de Radio-Canada. Madame Tam, bonjour.
Bonjour.
Cette semaine, vous avez surpris quand même beaucoup de gens avec vos recommandations en ce qui a trait aux relations sexuelles, où vous disiez de porter un masque, de favoriser les relations sexuelles individuelles. Est-ce que c'est vraiment un problème? Est-ce que vos chiffres démontrent qu'il y a un énorme taux de transmission dans la population avec des partenaires qui ne sont pas réguliers? Ou est-ce que vous allez un peu loin? Parce qu'il y a beaucoup de gens qui disent c'est peut-être un peu loin comme recommandation.
Donc, j'encourage les gens peut-être de lire les recommandations plus étroitement, parce que c'est vraiment des recommandations pour les gens qui peut-être vont engager dans une relation sexuelle avec de nouveaux partenaires. Les gens qui ne sont pas dans votre bulle sociale, ne sont pas dans votre famille, ne sont pas dans votre relation qui est vraiment je comprends dire confiance, avec confiance. So it's about trusting relationships. I know, je sais bien, très bien que, par exemple, les jeunes adultes qui vont retourner à l'université ou dans les situations comme ça, vraiment faites attention pour les liaisons avec les gens qui ne sont pas dans votre réseau bulle social. Donc, il y a plusieurs étapes pour réduire le risque. Le masque est comme une étape. Mais comme toujours, je veux dire que monitor your symptoms, right? Do not get close to someone if you're sick. N'approche pas les gens quand tu es malade. C'est la première chose. Limit sometimes your alcohol and substance intake. That changes your judgment. That's another layer. We know, guess how this virus is transmitted? Through your respiratory secretions. We're talking about saliva testing. The saliva has virus. If you don't know the person, if you do not know enough about this relationship, take care. If you're going to enter the relationship, this is a harm reduction measure, consider wearing a mask because fundamentally saliva is how you're going to swap viruses. And also be aware, what I've just said is take your own risk assessment. If you have underlying medical conditions, reevaluate your risk. Do you know what your partner's underlying medical conditions are? And that's on top of safer sex practices like using condoms. STI rates, and we talk about other things happening at the same time as COVID-19, are increasing. So layer on your safe sexual practice. So I wasn't really talking about people that you've already entered into a trusted relationship where you can take all those measures. It's just that I know that some people, as social spaces open, as people increase their mixing, is going to have to take some educated approaches to reduce the risk. Donc, c'est tout.
Puis, pour faire un peu de millage là-dessus, mais plus largement, on a entendu le premier ministre Legault dire il y a du relâchement. Il est inquiet de voir les chiffres augmenter. Vous, quand vous regardez ce qui se passe au pays en ce moment, l'automne qui s'en vient, les écoles qui recommencent, l'université, etc., avec les facteurs de risque qui augmentent, les chiffres qui augmentent, comment vous vous sentez? Comment vous voyez la situation en ce moment? Êtes-vous inquiète?
Donc, c'est... Maintenant, notre pays est un grand pays. Il a des situations différentes dans les provinces et les territoires différents aussi. Donc, il y a des quartiers, des communautés, des provinces qui n'ont pas beaucoup de cas. Mais dans les grandes villes, dans certaines régions du pays, il y a une augmentation de cas, surtout dans les jeunes adultes, entre 20 ans et 39 ans pour la plupart. Donc, c'est vraiment important de réduire le risque rapidement maintenant. Un autre chiffre très important est le taux d'hospitalisation, bien sûr le taux de mortalité, mais le taux d'hospitalisation, vraiment maintenant, c'est assez bas. C'est pas, il n'y a pas une augmentation. Mais il est vraiment nécessaire de garder le cap, comme je dis. So right now, the rise in cases is in young adults, and there is something that we can do about this. So again, you can actually reduce this by everybody following public health measures, which is what all of my colleagues around the country are trying to do. They will have no hesitation to increase public health measures should they see that things are not going in the right direction. But none of us wants to go backwards. So the only way to not sort of go back and have more restrictive public health measures is if everybody actually does their part. A lot of the clusters or outbreaks are in private settings, within families, parties. But if they see there's more cases in pubs, karaoke, and those situations that cannot be managed by increased sort of review of the existing measures, I'm sure they'll do whatever they need to reduce the cases. So, but as I've said, the fall, as people come back to congregate more indoors, we are going to expect some resurgence. Now is the time to get serious, really. But everybody can do their part. Young adults, as I said, have lots of ways to be able to use their ingenuity, use their knowledge to reduce the risk amongst themselves and others. But remember, you have parents at home, you have grandparents, so do your part also in helping us reduce decelerate the acceleration that we're seeing in some parts of the country. Every day I'm watching things very closely with provinces and territories. Right now, based on what I've heard from all my colleagues, things are under manageable control. But it doesn't take much if people don't all follow advice. This virus has a way to accelerate. But that's what I'm hearing from public health systems across the country right now. Yes, so I think there were some reports about a statement that I put out just recently. I think sexual health is a really important part of our overall health. And I was trying to provide a reminder, this is nothing new, that if you choose to engage in in-person sexual encounter with someone who is outside of your household or your close contact bubble, there are steps that you can take to reduce your risk. And it has to be based on good communication and trusted relationship. But there are layers of measures to reduce your risk. So, as I said, you have to monitor your symptoms. Do not get close to someone if you're sick. Stay home. Limit the use of alcohol and other substances if it's going to reduce your ability to take control of your situation and know that you're taking the measures. Saliva, respiratory secretions are where viruses live, the COVID-19. So reducing face-to-face contact, kissing, putting on your mask is layers of protection. That's actually quite sensible. And be aware if you or your partner is at high risk of medical conditions. So as well as, of course, other safe sex practices, using a condom, etc. So it's really also targeted at young people who are already having an increase in risk. So if you're looking at a population, this is the group that has an increase in rates. And if they're going back to university, if they're increasing the socialization, much as we ask people to distance themselves, they're going to get into these situations, and they can take strength from themselves, take control and reduce the risk. So it was just a set of what I think aligns with other, guidance and practices that many public health institutions have already provided.
Thank you, Doctor. Next question, CTV.
Hi, Dr. Tam. Kevin Gallagher, CTV National News. We've seen before, after long weekends, particularly, say, Canada Day long weekend, that there are increases in infections, sometimes regional outbreaks. So what have public health officials learned now going through the summer, and how does that tie into your advice on sort of how to be safe during this Labor Day long weekend?
Yes, so again, I think the situation appeared to have been a bit different across different parts of Canada, but we did see during July some increase in cases, which of course have been put under manageable control. It takes a lot of work from public health to and on the work of the part of the public to keep things at manageable control. So anything that anyone can do individually to reduce the risk to themselves to transmission is really important for Labor Day, especially as we are getting kids back to school and also post-secondary institutions are looking at how to reduce the risk in their own setting. So you cannot hold big parties, gatherings, privately or otherwise. It is the kind of setting, we've heard it from British Columbia, from other provinces, that it's those kind of settings that have contributed to outbreaks, some of them pretty large. So you have to respect the physical distancing measures beyond your immediate social circle and keep that social network consistent. That's the other aspect of that as we go into the fall. So there's lots of things which could escalate cases in the next several days. The sort of the vacation behaviors, get that managed. It is getting cooler. I can sense the weather changing and people sort of being less outside. Prepare your indoor spaces to make them safer. And try and today I offer some questions that people can ask themselves before they engage in any activity or event. We'll take a look at them and all the public health advice. All I can say, it has worked. Public health measures have worked to date in reducing cases. So we can do it, but it takes work to keep it under that slow burn. But we have to keep it there because it actually enables us to keep the social economic spaces open in this sort of new normal context. So you're absolutely right. So any long weekend, we have to keep reminding the public and everyone keep reminding themselves that whatever you do, every single person's behavior counts.
You mentioned schools reopening, and that's a major concern for a lot of people, that there will be an increase in cases as more kids go back to school and then coming home to their parents, seeing friends they haven't seen in a long time. What metrics are you and other public health officials watching? What are the main concerns? Obviously, like what can be done to alleviate concerns about children going back to school, but also what needs to be paid attention to know if the situation is getting very serious or perhaps posing a greater risk than is worth having.
So certainly is a topic that's at the top of family discussions and all across Canada. And schools, local public health, teachers, parents have been sort of getting together to plan for making schools as safe as possible. The first thing is, as we keep reminding everyone, that schools, the first thing is to ensure that you keep community transmission low. Based on what we've seen in other countries, you will see cases in schools, but they reflect what's happening in the community. We need to gather more information from any school-related cases. And so working with chief medical officers, we have to work together to have cases that are in schools reported and any outbreaks. Of course, you can get cases from schools reflecting your community acquisition, but you need to investigate if there's more than one case whether any transmission could have occurred in that school setting. So far, internationally, there have been some reports, but there's many, many thousands of schools that have opened safely. So I think we are working together on how to report outbreaks consistently, how to investigate them in a more harmonized way, so we can learn more about what actually happens in schools. We can also learn more about not just where there have been cases, but where there haven't been cases. So what measures have worked? And so those are the kind of areas of information sharing and gathering, I think, that we need as we go along. The other thing is just to keep reviewing the data and course adjust as needed. So at an individual school level, but also more broadly, the provinces will look at their policies as well. So this concept of mitigation, management, learning from that cycle and adjusting based on those lessons learned The other thing, obviously, at a more macroscopic level, you can also look at shifts in the age group of COVID-19 cases. So we know it shifted from a certain demographic for the first wave, which is a lot of more seniors affected, into this young adult age group. We're watching the young adult age group really carefully to see if it spills over back into the older age group. The next thing we want to look carefully for then is the under 19s. Within the under 19 age group, we want to be able to break down into the younger kids versus the youth and adolescents so that we can learn about. So those are some of the indicators for sure that we'll be looking at. And then from them to see if they are capable of spreading. So right now, what we know is that perhaps older kids are more like young adults, whereas younger kids appear not to be spreading in other based on information to date. But again, we don't have all the information, so it is important that we keep collecting the information.
Thank you, Doctor. We will now turn over to the phone. Opérateur, prochaine question.
Notre prochaine question est de Hélène Bigetti du Devoir. À vous la parole. Please go ahead.
Oui, bonjour, Dr. Tam. J'aimerais vous entendre concernant le transport scolaire. Est-ce qu'il y a lieu, à votre avis, de réduire le nombre d'élèves par autobus pour permettre une plus grande distance entre eux? Est-ce que ça donne quelque chose?
Oui, nous avons mis en place des lignes directrices pour les écoles de institutions éducatives et même les transports pour les élèves. Donc, il y a des méthodes pour réduire le risque, comme la distanciation physique, bien sûr. On peut mettre les enfants dans la même famille, ensemble, par exemple. Mais dans l'autre cas, réduire le nombre des enfants dans un autobus est une autre méthode. Mais mettre des masques aussi, si ce n'est pas possible de faire la distanciation physique, comme une autre couche, une autre méthode de réduire le risque.
Mais je vous pose la question parce que le masque, il est obligatoire dans les autobus, mais on a quand même, à certains endroits, réduit le nombre de places, ce qui fait qu'il y a des jeunes qui n'ont plus de transport scolaire. Donc, est-ce que c'est nécessaire, en plus de porter le masque, d'avoir moins de monde dans l'autobus? Surtout que, par ailleurs, il y a plein d'autres élèves qui prennent des autobus de ville dans lesquels le nombre de passagers n'est pas, lui, contrôlé.
Comme je dis, il y a plusieurs méthodes de réduire le risque. Donc, dans certaines situations, peut-être c'est possible de réduire le nombre d'élèves. Peut-être, je ne connais pas toutes les situations. Peut-être dans un petit village, ce n'est pas la même chose que dans une grande ville. Il y a la politique de l'école de, comment on dit, to stagger the start time pour certains groupes des élèves de commencer l'école à un temps différent aussi pour réduire les impacts dans les transports en commun. Mais il y a des règles, des politiques aussi pour porter des masques, pour les hygiènes personnelles aussi. Dans le transport en commun qui est déjà en place dans la situation locale.
Parfait, merci, docteur. Prochaine question?
Nous n'avons plus de questions pour le moment.
Parfait, merci beaucoup. C'est ce qui termine la conférence de presse pour aujourd'hui.